600 KCOL. The Centers for Disease Control and Prevention are everyone 6 months and older get vaccinated for the flu. And since the holiday travel periods present a good opportunity for flu to circulate, officials are urging people to visit their health care providers, county health departments, or pharmacies to get the flu vaccine to ensure sickness does not get in the way of participation in these festivities for themselves as well as for their loved ones and friends. Influenza can be a serious disease that results in hospitalization or death. It crosses all races, ages, genders, and ethnicities. Those especially at risk of complications of flu include adults 65 and older, children younger than 5, pregnant women, and people with long-running medical conditions, and are therefore among those strongly encouraged to get the vaccine. So what can we do to keep from getting the flu? Joining us now is Doctor of Internal Medicine, Dr. Al Johnson. Doctor, good morning.
Good morning.
I always say the best thing to do is to wash your hands.
That's the best way to keep from spreading the virus and bacteria even, so that other people pick it up, and then, of course, they're touching their face and eating utensils and so forth. Washing your hands is important, both if you have the flu or are sick, as well as if you don't, so you aren't transmitting germs directly to your face and nose area.
How could a person possibly not rub their eyes or touch their face at all? And then, of course, don't handle food either, by the way. We should mention that.
We've got to be reasonable with what we're doing.
Yeah.
So you just need to be cautious where do wash your hands when you're in the situations where you can get exposed. And, carry tissues with you so that if you are sick and you're sneezing, you sneeze or cough into a tissue, not into your hand, and then you're touching other items. So those are things you can do that protect other people from whatever you have.
Doctor, I'll never forget one day going into a fast food. This is 20 years ago. Going into a fast food restaurant with a colleague of mine and ordering French fries and a burger, and when the guy was putting the French fries into the bag, he sneezed right into the bag.
Oh, gross!
and then he hands the bag to my colleague Greg. And Greg says, "I don't want that." And this worker, he said, "Why not?" And he said, "You just sneezed into it." "Oh, sorry. Would you like some fresh food?" And he says, "Yeah, and go wash your hands, would you?" Pretty amazing. I guess we do things without thinking.
And that's where education comes in, and I'm glad you're talking about it on the radio show this morning.
Exactly. And that day we talked about it on the air. It was pretty amazing. How about the flu shot? Is it effective?
Yes, the flu shot is effective. They have different strengths. So, weaker dose for children, regular dose for adults, and then higher dose for older people. Talk to your physician about it. It makes sense to get it. It takes about 2 weeks to build up tolerance. The height of the flu season typically is at the end of January, February. And so if you got your flu shot really early, some people's immunity will wear off, and they may need a second flu shot. So talk to your physician about that also.
Is it an urban legend, or is there any truth to the fact that when you get a flu shot, you could be getting the flu from the shot?
Well, the flu shot, the actual shot, does not have live vaccine. It's not a live vaccine, so you can't actually get infected. Now, it produces an immune response that acts just like the flu. So some people's immune system will perceive the antigen, and you get that response that appears like the flu in your system.
Very good. Dr. Johnson, thank you so much for joining us, and have a Merry Christmas.
Oh, you're welcome. Have a healthy one.
Absolutely. We'll do our best. Thank you, sir.
Thank you.
That is Dr. Al Johnson.
I've always wondered about that. I've never gotten a flu shot because I'm scared of getting the flu.
Yeah.
Now I know what it's doing.